one way or the other medically. Today is not left out. It's still a wonderful day. My name is Amos Paul, and here with me I have some special guests that will be discussing something unique, something beautiful, something that is affecting us all over. As you see, this disease has something peculiar about it. It does not have symptoms. Wow. When I hear of such things, I get scared. But most of it does not have symptoms. But what we're going to hear from some professionals, you will not mind me getting my paper because some of their terminologies and names have to give me an assignment. Don't mind me, I'm still a Nigerian, so I always catch up. Well, I have two wonderful guests who are medical doctors that are here with me to discuss. First person I have Dr. Isaac Bowie. Dr. Isaac, did I pronounce that name properly?
Yes, yes.
Are you sure?
Bowie.
Bowie. Okay, interesting. I'll get to that. She's a doctor of optometry, right?
Yeah.
I've tried.
Yeah.
Wow, I think I have to tap myself on the back.
Yeah,
Yes. And also Dr. Grace. Let me skip the A. Ahams, Ako, because he said that A, we should just leave it by the side. She's assistant chief ophthalmologist at Taraba State Specialist Hospital, and also the head optometry services of the same hospital. And at the same time, she's the chairperson of Nigerian Optometric Association, Taraba State Chapter. Doc, did I do too much? Anyway, maybe when I grow up, I want to be like you. So, ladies and gentlemen, our viewers out there, just like I said, we're going to be discussing something beautiful. We're going to take a little time out of some few seconds. Just don't press the dial.
Wannan sako ne daga gidauniyar TY Danjuma.
So viewers, once again, you're welcome back to the program Haske Doctor, where I said we'll be discussing something beautiful. And the topic today is glaucoma. Did I pronounce it correctly?
Yeah.
I'm thinking I'm doing wonderful today. So let me start with Dr. Isaac. I can call Dr. Isaac, right?
Yes.
Dr. Isaac, can you tell us what glaucoma is? Because we know it's your week that you're celebrating this program. Can you tell us a little about it?
Okay, glaucoma is a group of diseases. It's not actually one.
Oh, it's
a
more
group
than
of-
one.
Yes. It's characterized by increased intraocular pressure, visual field loss, and optic nerve head damage.
Okay, help us with a little English here.
Okay, what it means is it's a disease condition that affects the optic nerve head. The optic nerve head is the part of the eye responsible for vision. So what glaucoma does, it goes and damages that part of the eye. And it also causes increased intraocular pressure. Just like there's a fluid in the eye that helps to keep the eye to send nutrients to different parts of the eye and keep the eye healthy. You know, for everything that is produced, there must be excretion. And there's a passage in which the fluid is being drained. For certain people, the passage is narrow. For certain people, it is open.
Wide.
Yes. So when production and drainage is not the same, the fluid can go and accumulate and increase the pressure of the eye and also damage the optic nerve head that I'm talking about. So for certain people, the passage might be open but have little blockage.
Okay.
So the fluid doesn't drain enough. So whenever there's increased intraocular pressure and optic nerve damage, there's usually visual field loss. Visual field loss is like a typical example. Some patients will tell you, okay, I can only see in the middle. They will no longer see. They start losing their peripheral view.
Okay.
Like in some cases, you
There's
show them.
going to be like shadows around.
It's completely dark. Like they don't identify. If 5 people stand, they might see only the 3 in the middle
Wow.
and not see the 2 by the side because the peripheral view is gone. So that's what glaucoma does. So it's characterized by all these things that I have mentioned. That's why it's called a group of diseases.
Okay. So usually it's like a filter that filters out the liquid,
Yes,
but then the
exactly.
liquid is like it's not filtering properly. Maybe my socket way is blocked.
Yes, for certain cases, just like a
You see,
what the other people call laria.
laria sieve.
When the water is not coming,
Okay.
there are small holes.
Okay.
So it goes and gathers. You know when you're using a sieve and it's blocked, it will
Yes.
gather together exactly.
Oh.
So now can cause pressure in the air.
Okay. So it doesn't go properly, so there's plenty of pressure because it's not flowing properly.
Yes, then for some people it's narrow, so it's not flowing properly. So any which ways, once production and excretion is not the same, There's always an issue.
Dr. Briggs, she has said it. But what do you think? Now, she made it clear this is what glaucoma does. This is what it is. Now, basically, does it take a longer time for it to for it to become blind, or it takes just a short period of time?
Okay, so the progression of this disease, it really differs per person. And then the type would also determine how fast and then how
So there
severe.
are different types.
There are different types.
Okay.
And sometimes I was just smiling because when you really want to explain what glaucoma is, it may get too technical.
Okay.
So, but the idea is this: once the optic nerve is affected, it results in vision loss.
Okay.
And this vision loss is irreversible. When you come in at that point, if we observe, oh, there's a presence of an optic nerve damage, we would want to do a grading, so to say.
Okay.
And then, like Dr. Bonwe has said, though we see the optic nerve damage, for us to really determine to what extent we may require that you do an extra test, do a visual field test, the mapping, and patients are really able to appreciate when they see a mapping that, oh, these dark areas, it means I'm not seeing well. The lighter areas, it means, okay, these are the areas I'm seeing.
Okay.
But just to really buttress on the question you said, the severity depends on the type and then, yeah.
And the individual, so it can take any particular period.
Can be fast, it can be slow.
Yes. Yeah. But okay, when it moves now, can it be reversed completely, or is it that just
irreversible blindness?
Okay. So when it gets to a point that you can pause it.
Beautiful. Once it is detected and treatment commences, and we actually say management because there's no cure. Once treatment commences, we halt. We are able to stop the progression. We are able to stop, the deterioration and further loss of vision. So, in other words, we're able to preserve the level of vision that you still have.
Okay.
So that's really the importance of managing the condition. So, but when it's not detected and no management, no treatment starts, depending on the person,
okay,
the progression will just continue. And it can be fast, it could be slow, it could be a surprise. So, we've had people come in, I'm like, I just stopped seeing. And then you ask them, you can't just stop seeing like that. What happened? They'll say it was like 1 month. But when you do a fundal examination, you see a very large cup, and you know that this couldn't have started today. But because it's silent most of the time, there are different kinds. But most people fall under the primary open angle glaucoma. So that's really the one that is really scary because it's a silent thief of sight. That's the one that is mostly symptomless.
Can you break it down? Just a little bit of technicality, don't make it too technical.
Yes. So in primary open glaucoma, the pressure could be normal.
Okay.
The pressure could be elevated, higher than the normal usual range. But what you find out is that the patient is not aware of anything going on.
No pains,
no pain, no tearing, no discomfort, nothing. Usually, as I've seen, a patient comes for something else, maybe due to an allergy or an infection that makes him come to the clinic. Then you do a fundal examination because it's one of our routine tests to do a fundal examination. Then you notice that there's actually something going on that is way scarier than what even brought the person. That's even on the good side. On the bad side is when people come in at the point when they notice they're having difficulty in even moving around. They are bumping into things like she explained. There could be 5 people. You see the central 1, 2, but the sides, people at the side. Shadows. Thank you. They are just shadows, or you are completely unaware. You could be walking and you're bumping into things because you didn't even notice that those things were there. So at that point, it's usually way advanced. When people have to come in that I'm beginning to notice I'm not seeing well, it's usually very much advanced at the time.
Okay, Dr. Bonwe, let me come back to you. Historically, how are we going with this issue of glaucoma?
Okay, for now, I think the Nigerian Optometric Association and other eye associations are doing their best in creating sensitization, because as much as glaucoma is very dangerous, if people don't know, they will keep having reoccurrences of people going blind. So what we tend to do, like this whole week, yearly, the second week of March is usually dedicated to glaucoma, to creating awareness, because we are trying to keep saying it so that when people know, they will know that they will be able to know how to manage it, and if possible prevent blindness.
Yes.
And also for people, it's a way of encouraging people that are living with glaucoma to be able to know that, okay, these people are actually trying to help other people from being like me or getting into the, exactly, we'll be able to teach you ways in which you'll be able to manage. It's not easy knowing that for the rest of your life you're
You
going to
can't
have
see.
to, it's not even about seeing. You have to be on a particular drug for the rest of your life.
You only start the drugs for the rest of your life.
Yes,
Okay.
because we are trying to halt it. Because the moment you leave the drug, the condition
process
progresses. Exactly. So we help people that are living with it to be able to manage it and go about their normal lives like every normal person. Then help people that don't even know. Because there are risk factors to glaucoma. Like people that are 40 years of age, they are at risk of glaucoma. Africans, they are more risk of glaucoma than Americans. Some studies say women are more risk than men. People that have had cataract surgery are at risk of glaucoma. People that are diabetic, hypertensive, down some steroidal drugs are at risk of glaucoma. So there are a lot of risk factors. The most common ones ever are people that have family members that had glaucoma.
Okay.
Like if your father, grandfather, it runs in the gene, it could be genetic too. So
it's hereditary. Hereditary. I mean.
hereditary, exactly. So creating this awareness helps people to know that, okay, once, even people that have had trauma, you had an accident or just a fall and you hit, it could result into glaucoma. So glaucoma is one very, very, very small but mighty thing.
Yes,
Yes, because it looks for the littlest opportunity to just come in.
Dr. Von, when you said that, I just started thinking, okay, without going to see you guys in the hospital, how else can I protect myself from glaucoma? But you're trying to make me understand there's no way I can protect myself unless I keep on checking.
Yes, periodic check. Even people that have family history, we used to tell them to come periodically. 3 months, if possible, 6 months at least. That's
for those that are
annually.
families.
Yes,
Okay.
exactly. Or if you are 40 years of age, all those people that are at the risk, those risk factors, it's good. You check when you check periodically. If we don't see it now, like what Dr. Grace will say sometimes it can be missed. You can come to the clinic and I'll check it today and I will not see it. But when I check tomorrow, I might be able to notice it. So if you are coming periodically, if I missed it the first time, I won't miss it the second time.
So you're really saying it's a thief?
It's a sneak thief.
You don't even notice. Some people just wake up and tell you, doctor, I'm not seeing again. And the worst is that you cannot do anything about it. That's why it's painful.
Dr. Grace,
Yes.
now, as the chairperson of the organization, how have you seen this? How is it affecting us in Nigeria? How is the awareness going? Is it that people are getting to know more about it, or there's a lot of work that still has to be done?
Well, people are getting to know more about it, but nevertheless, there's a whole lot that can still be done. I just looked at my phone recently and I saw the recent statistics. I think as of 2 years back, if you would go online, they'll tell you that 50%, that's 5 in 10 people who have the disease are unaware. They don't know that it's there. But I looked in today and it says 9 out of every 10
Are you
who
serious?
have the disease are unaware that they have glaucoma. So it means that despite what is being done, there's still a whole lot to be done. Let's not forget that the population keeps
Yes,
people keep coming up. Maybe those who were children are now teenagers. They've added into that large workforce. So as population grows, it makes the gap even wider.
Okay.
So a whole lot can be done. And as an association, we're here. Throughout this week, we've been on several platforms. We've been on social media, posting it, the risk factors, letting them know that it's irreversible, but this blindness can be prevented if actually detected early. And to just buttress, the last question, it's not something that somebody can just look at you and say, it's like you have glaucoma. How some people will look at you and say it's like you have Apollo. It doesn't work that way. You need to actually look into this person's eye, at the back, at the retina, and observe the optic nerve head. That's the only way it can be done. And if not a professional, it becomes a very dear thing.
Well, viewers, you've heard just a little segment of what glaucoma can do to you, but we're going to still take a little break, and when we come back, we'll discuss more on this same issue, on how we can help ourselves, because now we've just said what it is, so we'll have to discuss how we can help ourselves. Don't go away.
Mutane sama da miliyan 80 a duniya na fama da ciwon ido na glaucoma, wanda zai iya haifar da makantar da ba za a iya warkar da ita ba har abada. Ita wannan cutar ba ta nuna alamomi, sai dai sannu a hankali tana rage kaifin gani ba tare da an lura ba. Ku kula da wasu alamomi irin su zafi a ido, amai da canjin gani na gaggawa. Duba lafiyar ido akai-akai zai iya gano glaucoma kafin ta yi muni. Kada ku jira har sai abun ya taɓarɓare. Ku ziyarci asibitin ido mafi kusa a yau. A wannan lokaci da ake makon wayar da kan jama'a game da glaucoma, kare idonka, kare makomarka. Wannan sako ne daga gidauniyar TY Danjuma. Mutane sama da miliyan 80 a duniya na fama da ciwon ido na glaucoma, wanda zai iya haifar da makantar da ba za a iya warkar da ita ba har abada. Ita wannan cutar ba ta nuna alamomi, sai dai sannu a hankali tana rage kaifin gani ba tare da an lura ba. Ku kula da wasu alamomi irin su zafi a ido, amai da canjin gani na gaggawa. Duba lafiyar ido akai-akai zai iya gano glaucoma kafin ta yi muni. Kada ku jira har sai abun ya taɓarɓare. Ku ziyarci asibitin ido mafi kusa a yau. A wannan lokaci da ake makon wayar da kan jama'a game da glaucoma, kare idonka, kare makomarka. Wannan sako ne daga gidauniyar TY Danjuma.
Viewers out there, once again, you're welcome back to Haske Doctors. As you have heard and seen us, we are trying to create awareness on glaucoma, which is a disease that is celebrated, let me use the word celebrated, all over the world throughout this week. Why do we call it celebrated? Because we're trying to create awareness on how people will get to know what this is all about. When they started talking, they gave me the goose pimples, and I think it's not actually my fault. So I'll still come back to you, Dr. Grace. Dr. Grace, you have been hearing so many things and you've been interacting on this same issue. How can the government and other individuals come in to make this awareness properly so that people can be able to know? Don't also place billboards everywhere or what? Because as you're saying, it sounds scary.
Well, thank you so much. There's a whole lot that can be done. On the government's angle, I'll just share statistics. I said detecting it really requires a professional. And how many optometrists do we have actually even in the States?
How many?
3. Employed by the state government.
3?
Yes. We have other optometrists, but they are in the FMC. But in the entire state,
that's for the state government.
Entire state, yes,
of Taraba.
Of Taraba State, there are 3. So these 3 are located in Jalingo.
You guys don't even go to the villages.
So they are general hospitals, they are primary healthcare centers. These are places where professionals should be employed, because it will also help. Because they are professionals, they know what this is. They know the impact of what glaucoma is. They are able to detect it better. I sometimes imagine, I said, in the other 16 local governments or 15 local governments, how do they assess eye care services? Who handles these conditions or whatever conditions they present with? It's quite a very low figure. For those also who have glaucoma, like we said, it's something the treatment or management is something that is for life. They need counseling. Because to get to a point where I've used my drugs for 5 years and I cannot see any difference. Why do I have to keep using my drugs? I'm spending this money, but I can't see any difference. Unfortunately, even okay, I told you earlier we were at somewhere with Mr. Wandi, who is currently functionally blind and happens to be the chairperson now for the Association of the Blind Taraba State Chapter. He was diagnosed at 18 years. Though he was diagnosed, he chose to do other options, but the outcome led to the fact that he's where he is right now. And he said something that though he's not seeing, he is still using the eye drops.
For what?
Good question. There are some people that, imagine if you were, let me use the word blind, even though we don't like to use that word.
Yes, yes.
But yet, you were experiencing pain. A painful blind eye. That's uncomfortable. I'm not seeing. So why is this eye disturbing me? That's one. Then secondly, there are some people who are not seeing, but they are able to just appreciate, oh, I noticed, when you close your eyes and then light is turned on.
Yes.
You could appreciate that. Thank you.
Light.
So that level that he has, he still doesn't want to lose it. He doesn't still want to be in total darkness. So he still has to use those eye drops to just keep, even though he goes around with a cane, he cannot really look and say, oh, this is Amos, this is Bonwi, or, But yet, he still has to use his medications. He still has to buy them. It costs money. So how can the government come in and individuals, NGOs, I wish they could set up a fund, provide medications, stock them up in the pharmacies, so that when we find people or diagnose people who have glaucoma, they can access free care or subsidized care. Because there are different kinds of medications. Some are cheaper than others, and depending on when you are detected and what I call it, the advancement or how far it has progressed, the medications will differ.
They will differ.
And so that price too, the cost of it will differ. Some drugs 1.5, some drugs as much as 7,000 to 10,000. That's a whole lot, and you do this monthly for the rest of your life. So government can come in, make drugs available, either at a subsidized rate or even free. NGOs can partner. NGOs can even partner with the association so that more outreaches, awareness can be done. We are in the city. How about someone who is in a hard to reach area or in the communities, or someone who doesn't even understand English? Information can be translated into local languages so that they know, and whenever they have the opportunity to, they go check their eyes. I spoke to someone earlier and he was just wanting to know if it's free, everything is free. I said you have to get to the point where you are responsible for your health. A lot of people like free things and they will only want to go when it's free. But we are saying that you have to go check your eyes every year. It has to be a habit. Own your health and be ready to spend for your health. If you will not spend to be healthy, what else will you spend for?
Dr. Bowie, I'm tired of us. We're just scaring me.
Okay.
Give me your last words, and what can you say out there to make people to understand the value of how we can eradicate glaucoma? I'm talking of eradication, and they are making me understand that it's something that we can eradicate.
Since it's genetic, some people didn't plan for it, but their forefathers gave it to them as a free gift. So, for me, I would like to talk to those already living with glaucoma, especially with the fact that you have to be on the drugs for the rest of your life. Partially blind is better than totally blind.
Yeah, that's true.
No matter what.
That's true.
You don't have to work with. They said every other kind of defect you have, a lame man, someone that has a cocoa arm, or every other thing, you might not need help. But a blind man always has to seek
Yes, he needs
assistance at one
assistance,
point.
constant.
Exactly. So the fact that your vision is not as wow as it used to be or powerful as it used to be doesn't mean that you should not be able to preserve this which you have. Because that which you have is better than what you have lost. Exactly. So just encourage yourself, eat healthy, take your drugs, and you could live life normally. Yes, you don't see so well, but you can live your normal life. So encourage yourself in the fact that I still have something. I'm better than the person that just lost his sight. Because every given minute, people lose their sight from glaucoma. So the fact that you are able to buy these drugs and able to take them should be a form of encouragement for you.
Listeners out there, sorry, viewers out there, you've heard from two powerful doctors. They are telling me that there are only 3 of them in Taraba. So I don't even know what to say. I don't know what other states, how many they are. But this is something that we have to create an awareness and for people to be able to know the value of what this disease can do to you. It is incurable and it is not something you can plan for and say you can prevent it. But you just have to be checking yourself constantly. Yeah. The Tiwa Foundation deems it upon itself to make it possible for you to be able to get to hear about this problem. And right now in Takum, if you're in that area, you can walk into their hospital and there's free eye tests. Well, just like Dr. Grace said, we are wishing and praying that this can go around all over so that everybody can be able to get the awareness and test their eyes. Now, they've just scared me to make me understand that I have to go and check my eyes. I think 3 weeks ago, I was able to go and get a pair of glasses. Maybe I should go further to check for glaucoma because we don't know how bad it can be. Dr. Howe, thank you very much. Yeah. Dr. Grace, thank you. I wish we would keep on talking, but time is never going to be our friends, and so many things are needed. Well, viewers, this was Haske Doctor. Once again, be with us some other time as we give you and refresh you with more things that are going to help you as a person on how you can survive better. From those of us in the studios and the special guests we have, we say thank you and have a wonderful evening.
Mutane sama da miliyan 80 a duniya na fama da ciwon ido na glaucoma, wanda zai iya haifar da makantar da ba za a iya warkar da ita ba har abada. Ita wannan cutar ba ta nuna alamomi, sai dai sannu a hankali tana rage kaifin gani ba tare da an lura ba. Ku kula da wasu alamomi irin su zafi a ido, amai da canjin gani na gaggawa. Duba lafiyar ido akai-akai zai iya gano glaucoma kafin ta yi muni. Kada ku jira har sai abun ya taɓarɓare. Ku ziyarci asibitin ido mafi kusa a yau. A wannan lokaci da ake makon wayar